So I'm speaking today on how to structure successful therapeutic interventions without necessarily resorting to a protective separation or sometimes what's called a reversal of custody. And it is a vexing problem. You find in almost all contact refusal cases or parental alienation cases or contempt of court cases that there are elements of individual child therapy or family counseling that have been tried and been unsuccessful. Sometimes multiple attempts with multiple different clinicians with different backgrounds, sometimes extending over years, and still no success. And there are a common list of structural problems and methodological problems and even conceptual problems in throwing unstructured therapy at a resistant family structure where the family on its own is not restructuring in a healthy fashion. So we know what does work, and what does work at the end of a very long, difficult road is a protective separation where the children are removed from the favorable parent who's causing the family pathology, placed with the other parent, and then eventually reunited with the family after therapy, what we really consider a psychoeducational intervention, takes place with everybody after the structural intervention. And generally those families come back together and reconstitute in a healthy fashion after that intervention. I just recently got my third in a row successful defense of an appeal of a protective separation construct at trial. And it worked even before the psychoeducational intervention. 90% of the success in the most recent one actually happened just by virtue of allowing the rejected parent the opportunity to parent and to show their caregiving, and the therapist then had an awful lot to work with thereafter. But courts tend to be very reticent to do that. They want to see that all other potential interventions have been tried first, and for good reason, although there is often a lot of consideration after the fact that that intervention ought to have been tried earlier. We have some developing law in Canada basically starting to recognize that, and where you've already gone through a couple of rounds of failed conventional therapy and there's pervasive and long-standing non-compliance with court orders, there's no need to force the family through a whole trial. You should try this, which is always inherently an interim or temporary remedy, and then you work the favored parent back in and monitor the children for any regression. Sometimes it happens a bit more informally with make-up parenting time on a contempt case or a non-compliance case, which effectively does the same thing, creates a protective space. Child learns to reappreciate the lost parent because the attachment forms from the caregiving, and they now have an opportunity to experience the caregiving again. But the purpose of this presentation is to leave you with the elements of how to structure a successful therapeutic intervention without a protective separation, because that's going to be the case in almost all situations before consideration should be given to the necessity for a protective separation. And so the secret sauce, the difficulty is, how do you structure these given the pervasive failure? And there's a long line of jurisprudence that I'm going to just give you some of the key excerpts later on in this presentation, where courts recognize the futility of conventional therapeutic interventions where you don't have willing participants. But unfortunately, we do it again and again and again, somehow expecting the result to be different. And we all know that's the layperson's definition of insanity. There's some good sources for a lot of this sort of thinking. An article that is approaching 2 decades of publication is still required reading. Is the child's therapist part of the problem? Which was an article by well-known psychologist Lynn Greenberg, Jonathan Gould, Philip Stahl, published in 2003 in the Family Law Quarterly, and that would still be required reading. Various professional standards would apply depending on the background for the treating professional, and there's industry guidance, one example of which is the AFCC standards for court-involved therapy. Notwithstanding all of that, this is truly a specialized knowledge base where the best practitioners have lots of ongoing practical experience. And some of the perils that is indicated if you go through jurisprudence and you participate in these unstructured interventions can be summarized, and therefore when you structure it to avoid the issues that plague this area and cause such pervasive failures. The number one peril is the very premise of traditional therapy, which is the therapeutic alliance. And simply stated, the therapeutic alliance is a non-judgmental relationship between the therapist and a particular participant, under which the understanding is the patient will not be pushed, will not be in particular pushed out of their comfort zone, will not feel judged, and in return, they'll lower their psychological defenses and be honest about what's bothering them and be prepared to accept suggestions, etc. But it's not a directive process. It is a journey of professional and patient exploring together causes and potential solutions to the patient's feelings and whatever they're struggling with. And that obviously is not the background in the types of situations that we're dealing with in the cases to which this presentation is directed. You have unwilling participants, generally the favored parent and the children, and they are absolutely fixed in their views. They do not want to be challenged. They do not agree with the supposed goal of the process, and they'll do everything possible to sabotage it or not to show up. So the very essence then of individual therapy or unstructured family therapy, the therapeutic alliance is a poor fit for these sorts of interventions. In addition, traditional therapy often will involve the siloing of information, particularly if it's an individual referral. So child gets referred because child is having difficulty coping or has an impaired relationship with a parent. Various issues arise. The child will say various things and not want them repeated to anybody else. Well, that's a recipe for disaster if the purpose of the therapy is to deal with and repair and restore relationships. It certainly can't be done with that sort of privacy stricture. Secondly, just meeting individually with the participants instead of a rejected parent and child at the same time, where the therapist can observe the interactions and the negotiations and the power dynamics and the problem resolution skills or impaired problem resolution skills, is just not going to work. You can't work on a relationship in individual meetings. And yet this is exactly what we see time and time again. We see individual therapists just based on input from either the child or the child and the favored parent who brought the child there, coming to conclusions and judgments about the other parent who they haven't even met. We see therapists in these situations advising their child patient that child seems very upset about parenting time with mom, and that's okay. If it upsets you that much, you shouldn't have to see your mom, and even in the face of a court order. And needless to say that that's not allowed, but it's also particularly damaging. Therapists are often trained in individual pathologies, but not family relational dynamics, particularly in the context of a fractured family and contact refusal problems and PA cases. They just don't really teach this thoroughly in the university programs and other training that most therapists are getting. And in part, I know this because my own daughter is a clinical psychologist, and she and I often speak about our areas of overlapping interest. And once again, even that higher level of training, these are very bright people just to get into these programs in the first place, is focused on individual pathologies and not family relational dynamics. There's often in unstructured therapy a lack of articulated goals, a disagreement on the presenting problems, almost always a lack of a strategic therapeutic plan. And so it just goes on and on and on like an annuity. In one case where I was cross-examining the therapist who actually was a psychologist, I asked how long his therapy would have gone on had the court not intervened and imposed a protective separation. And his testimony was in the back end trial where we were trying to pull the family back together again after a successful period of protective separation. And he basically said he wasn't quite certain, but it would certainly be a minimum of 4 years. Well, that just can't be right. And if you look through the professional literature, you'll often see something like, if a particular intervention doesn't meet its goals within 6 months, it's not going to happen. And you should also have milestones along the way. You shouldn't wait till the 6th month to suddenly conclude that we're not going to get to where we need to get to in any reasonable period of time. You'll see that early on along the way. Another common issue is a breach of the dual role prohibition. An individual therapist for a child, for a parent, cannot then morph into having a family therapy mandate. Marriage counselors cannot continue on as counselor to one of the parents after the marriage counseling breaks down. Forensic assessors can't, after their report comes out, subsequently provide therapeutic services to the family, or vice versa. If you're an involved therapist with the family, you can't then take on a role of an objective standoff forensic assessor. And yet we see breaches of the dual role prohibition, and you'll find that prohibition in the professional standards for almost all of the helping professions. And yet we see that very frequently. You'll find therapists who just emotionally, they're people too, have adopted one of the narratives in the dysfunctional family system. And they don't realize it, but they've strayed into advocacy, or they're now prey to a lot of the cognitive distortions that our good colleague, Dr. Steve Miller, has frequently spoken about and written about. Another issue we find is where the individual therapy, which might have started for good reason if a child is having problems with peers or anxieties, but then that process starts to conflict with the parallel family therapy or the parenting coordination for the parents. And the narrative within the siloed individual private therapy for therapist and child is conflicting with the agreed and necessary narrative coming out of the court and the family therapy process. There's a great quote from Daniel Kahneman, frequent prolific author, in his book, Thinking Fast and Slow. And the quote goes as follows: "We know that people can maintain an unshakable faith in any proposition, however absurd, when they are sustained by a community of like-minded believers." And that's the problem with unstructured therapy. It doesn't give you the opportunity to really challenge the false narratives. Another common problem is some jurisdictions allow the commencement of services at the request of just one parent, whether or not they have sole decision-making authority. And that's going to prove to be problematic, frankly, even if they have sole determination authority for medical and therapeutic services, for the very reason I stated, that in that process for the child, you'll only get one narrative. And so there may be good practical or effectiveness reasons to not provide services there unless with the consent of both parents, or at the very least, the participation of both parents. The other common failure that we see is the pacing of reconciliation therapy being far too slow, and these sessions spread out too far, so that effectively you're starting back at ground zero, or you're back in the batter's box every time. And these things require active management at least once a week in order to maintain momentum and progress. The therapist has to be very careful about transference, and particularly in an environment where they're getting one narrative where the other parent is all the fault for the breakdown in the relationships. The typical targeted parent that a therapist is going to see is going to be really a shadow of the former self that they were in the intact family. They will be suffering emotionally from the perceived loss of their child. They'll be under great stress financially and time-wise in the family case. And that's not the time to judge them. That's the time for empathy and assisting them in dealing with their own therapeutic needs. And so family therapy would often be assisted with both the favored and the rejected parent receiving their own individual therapy, provided that the family therapy takes precedence and the individual therapy is supportive and there's good communication amongst the professionals. Now, we have some formal statements of contraindications of unstructured therapy from the expert community. So I would certainly recommend that everybody go to the website of the European Association of Parental Alienation Practitioners, which is a counterpart of PASG that I'm the legal editor for. And they have published a statement on their consensus views of traditional, generic, and unadapted therapeutic interventions in cases of fractured parent-child relationships. They published that in February of 2019. It's about 6-7 pages long. It's not just the statement. They give the research backup for that, the evidence-based backup for that, and that would be a document that's required reading. Other sources where you can go to see an expression of the perils of unstructured therapy in these circumstances is an article written by Dr. Kathleen Ray in 2015 in the American Journal of Family Therapy about the program she was running at the time called Family Reflections. Dr. Warshak, who's known to all of us and also a prolific author, in 2015 and 2018, had some articles out that parse the dangers of unstructured therapy. And once again, Dr. Miller at various presentations, including when he and I spoke in London, England in 2018, does a really good job of explaining some of these perils. Now, I mentioned before that the legal jurisprudence, the cases that unfortunately go all the way to a trial or some sort of full-day motion, are replete with references to the judge's observation of the one or two. The highest I'd ever seen was a case that settled just prior to trial, where there had been 9 separate therapeutic attempts prior to the case finally heading toward trial, and it was only the trial that really made any progress. But the case law is very instructive in terms of some of these observations, and actually pretty good pieces of judicial rhetoric, if you will. So here's one of my favorites from a case that went to the Ontario Court of Appeal in 2010, speaking about the pervasive failure of therapeutic interventions. And here the judge wrote as follows: to achieve success in repair and reestablishment of the relationship, you must start with the power, in this case, the father, and have him not only on board, but actively showing leadership toward all the children having a relationship with the mother. Without a child having permission to change, a therapist can achieve nothing. And that is such a truism that unfortunately does not seem to be in the forefront of knowledge of our typical cases where judges are telling families, why are you litigating? Don't come back until you've tried therapy. I'll give you an order for therapy here today. And then you get some unstructured order that the family will retain so-and-so or agree on who the therapist is for therapy. And that's really the only guidance you see in the referring court order. And I'll address that shortly. It's destined to fail if that's all you've got. But I just wanted to share a couple of other, just a little collection of other really good pieces of judicial rhetoric. So these are actual quotes from cases, and I've just taken the key phrase. So here's the list. An alienating parent can undo any work that is done in therapy with the child instantly. Another case. Joint counseling, dyadic therapy, has proved to be ineffective because children continue to be exposed to negative messages by the favored parent. Here's another one. The therapeutic environment may simply cause the children to become more entrenched in their views. And that's something that the European Association and many others have recognized as well, that the therapy just becomes yet another battleground to prove who's right, instead of everybody saying, past doesn't matter except to inform how we should all act in future. Aside from that, we let it go. We're not going to debate the past, and we're going to forgive and forget and talk about how we can make things better in future. But the premise is there is going to be a future together. And on that foundation, wonders can happen in a fractured family system. But if you're coming into therapy and just debating the past, you're going to spend a lot of time and a lot of money, and all it's going to yield is a lot of frustration and further paralysis. Here's another case. Including only the rejected parent in counseling reinforces the children's view that the rejected parent must be the problem. Another one. Further, the favored parent is likely to sabotage the therapy if the children appear to be softening their opinions of the rejected parent. Another case. Therapeutic involvement for 1 hour every week or two without a change in the overall family dynamic cannot penetrate negative thinking and belief systems that are entrenched. And so this is just a sampling from many cases that I use in my legal briefs where courts have recognized that whatever we're doing, we're not doing it right. And there's another famous piece of rhetoric, fail to plan is plan to fail. So we quite clearly, in these cases, need to think through what it is, what is the structure, what are the premises, what are the preconditions and understandings and commitments that are necessary to put in place in order to have a structure that has a hope of working. And that's ultimately where I'm going to wind up in this presentation, because I've spent most of the time so far explaining that what happens in the typical case inevitably fails and therefore is contraindicated in the sense that it's actually going to make matters worse. Because unless we learn from that, unless we learn from what it is about this, it's like motherhood, there can't be anything wrong with it. Of course, you should go off and do therapy. But that simple referral, the generic reference to therapy, is just so meaningless in the context of a fractured family where there are unwilling participants and where the goals are not in alignment, that there's almost no point to doing it. So I'll turn back to the consensus statement from the European Association of Parental Alienation Practitioners and some of the additional insight from that statement. So they do recognize that in moderate to severe cases of a fractured family system, traditional therapeutic approaches can lead to the family dysfunction becoming even more entrenched. There's recognition that where you've got the typical competing allegations of really impaired parenting practices, such that the children don't want to see that parent or rarely want to see that parent on the one hand, versus manipulation and alienation of the children on the other hand, a therapist handed those competing narratives with the goal of fixing everything has to have considerable clinical experience and specialized training. And I've previously mentioned that this isn't taught in the traditional settings. It's something that you learn by shadowing people who have developed expertise in the area and doing specialized postgraduate training. But there is one designation or discipline of mental health practitioners that comes closest to the type of core knowledge and training that's helpful for these fractured families. and that is the LMFT designation, Licensed Marriage and Family Therapist. There's an American organization that they may have trademarked that name, but they certainly have the right to control who indicates that they're a practicing member of that organization. There's a similar Canadian organization. And if you just spend some time on their websites and you look at the training syllabuses, you can see it comes closest to teaching family systems, family structures, power imbalances in families, which is what's going on in these fractured families. A lot of it has its roots in the family systems thinking of some of the leading practitioners in the 70s, Beck, Minuchin, and many others, who first recognized this concept of a pathological alliance, an unhealthy enmeshment of one parent and child or children against the other parent, and a diffusion of the structure of a healthy family system, which has hierarchies and it has boundaries, and everybody uses those to learn how to get along with everybody else and have the family function, even post-separation, if the hierarchies are maintained and the boundaries are maintained. You may have to work a little bit harder, but it's still possible to have a healthy family system post-separation. But that core thinking of family systems needs to be part of the practitioner's training and professional experience. The European Association warns against the perils of labeling a case. Oh, it's a high conflict case, so this family's structured because it's high conflict. It's meaningless, and it misses the boat on the actual cause of the dysfunction. Same with the word hybrid, which has become a catchphrase for the concept, there's enough blame to go around here for everybody, which also is not going to help the family. There are always principal or most influential or most damaging or most pervasive processes within a fractured family system that are the principal cause. Early on in my practice in this area, I coined a concept that I call the but-for test. And applied in a contact refusal or parental alienation situation, the but-for test would read as follows. But for the unsupportive actions and lack of normal co-parenting supportive actions of the favored parent, would this family system be fractured like this? Another way to look at it is, prior to the family breaking up, there may have been issues, problems, but whatever parenting style or parenting deficiencies existed in the rejected parent had not led to a complete breakdown in relationships and an expression of sometimes hatred by the children. In the latest edition of PAI, which is the bi-monthly journal of PSG, I have an article making ode to a fantastic judge who recently passed, who in a 1991 case, 30 years ago, recognized most of our peer review evidence-based understandings of these families today that arose over decades of subsequent research. You can find so much insight. So I recommend that everybody read that article, because I don't have time in this presentation to really pay homage to Justice John Gomery of Montreal, Quebec. But one piece of judicial rhetoric that springs to mind here from what I just said about children expressing hatred, Justice Gomery said the following: hatred is not an emotion that comes naturally to children. It has to be taught. And that's just a fantastic piece of judicial rhetoric. Further insight from the European Association that should inform properly structured interventions is the necessity to challenge the children's behavior, challenge the children's untrue, unjust, exaggerated, and delusional beliefs and thinking. In the therapeutic alliance, we don't do that. We may suggest that perhaps there's another way of looking at something. It's all very soft and supportive of a process. One way to look at the required intervention in a fractured family is that the actual patient is the family system itself and not any one member. And so in this directive process, we can put whatever label we want on it: educational intervention, which is what some of the advanced programs style themselves as, or reconciliation therapy, even though there's no broad-based standards for exactly what that means. But the fact of the matter is, it's directive, and there is no therapeutic alliance. The therapist is given a job to do. Here's this family. It's a mess. People aren't getting along. The hierarchies are broken. The boundaries are diffuse. Your job is to fix it and for the family to come out the other end with healthy relationships. And that understanding informs the key components of a structured therapeutic intervention. Further insight from the European Association is that accordingly, you need a strong, emotionally strong, intellectually strong expert to do this work. It's very difficult. Many of the participants are going to be resistant the whole way. And the therapist has to demand change of all participants in the family system. Favored parent, rejected parent, and children. Everybody's got to do better. Informed by the past, we won't debate the past, but we have a vision of a happier future, and everybody's got to do their part to make it happen. Further insight from the European Association is that parallel non-therapeutic parenting time is essential. So many of these therapy referrals, the unstructured ones, take place even in the face of a court order with a parenting schedule, but that parenting schedule is not being followed. And somehow they expect the therapist to fix that. Rarely can a therapist do that without the child experiencing the rejected parent, building new happy memories. Park the past, go out there, have fun, do caregiving, cook for the child, help the child with the homework, take the child to their activities and visits with friends and family. Be a caregiver, and the child will respond. But if you're denied the opportunity, which is a classic tactic of the dominant parent, then the child doesn't experience your caregiving. And a child experiencing the caregiving of the rejected parent is one of the key tools that the therapist has. In addition, we're informed by the European Association that there has to be an outside date for the achievement of goals, after which the matter gets referred back to court for a structural intervention in the family. So, all that in mind, what does a properly structured family intervention look like? Whatever label we're going to put on it. conventionally, I guess we're calling it reconciliation therapy. Well, number one, you need a detailed parenting covenant pattern. What are the specific supportive behaviors that are required to make it work? And secondly, what behaviors are prohibited as likely standing in the way of the success of the intervention? And I have a very extensive one, goes 5-6 pages. And it was a bit of an outlier at first, but I've gotten a lot of traction in the courts now. There's even some cases recognizing specifically that a high conflict family requires a highly detailed, lengthy, highly prescriptive court order. And even some judges in Canada have started publishing their own models that are appropriately dense. Recently, I've added another piece to my standard parenting covenant pattern, and that is what I call prohibited narratives. Every family system that is fractured has its narratives that stand in the way of healing, forgiveness, and restructuring. So, and sometimes they can be summarized as pieces of rhetoric. Mom left us at Christmas, and we never forgive her for that. Dad yells. And when you really probe, the word yelling, quite frequently in these cases, just means the parent had to exercise a boundary and say no to some request. But that is always reported back as yelling. Dad doesn't know how to feed the kids. Mom doesn't understand the kids. And these narratives just get repeated and repeated until they just take on their own truth, if you will, at least in the mind of the children. And of course, there is some science behind the thought that if you repeat something often enough, it starts to stick. And so I interview the family and come up with this list of allegations, assertion statements, whatever you want to call them, that are not to be heard from again. Whether or not they're true, whether or not they're exaggerated, whether or not there isn't even a kernel of truth to them, they're not helpful. So if your view of the other parent is that they're just inherently, organically, fundamentally abusive, well, then don't waste the rest of our time engaging in this process, because you're never really going to engage in it in good faith. So we tackle on the front end before the intervention starts these narratives that are predictively going to interfere with success. And that does not prohibit the family from discussing without blame or attribution within the therapy kind of what hasn't worked in the past and what things would be better if this could change, that could change. And just to show that all members of the family system have to change, there are a couple of attributes of many a targeted parent that you often see in these processes that have to change. Not because they're not understandable given what they're going through, but just because they're unhelpful to the very goal that they want. And one that I came across recently in a case I've summarized as hypervigilance. So the favored parent is intervening all over the place, phoning all the time, sending the kids with food, sending the kids with other supplies, all as if the targeted parent is a completely incapable parent. And over time, some targeted parents can become hypervigilant, jumping on just about anything as evidence that it's an attack on their ability to appropriately care for the kids. And so that overreaction, that hypervigilance is unhelpful and needs to be dealt with. But the one nice thing about working with targeted parents is they're highly motivated to do whatever they can to make it work. And sometimes with the favored parents, they're not highly motivated to make it work because there would go their power over the family system. So there are many things, and this presentation doesn't allow me to go into everything I've learned from all these cases, but they're typical things that we see from favored parents, from the children, from the targeted parents, that an experienced practitioner should be able to explain to people who are participating in good faith with a view to the expected healthy result and push past it. Other structural elements to be discussed and settled in advance include an appropriately detailed reunification therapy agreement with the particular practitioner. And of course, I've already mentioned select wisely, select your practitioner wisely. There are a couple of models in broad use in Canada, and I'll give a shout out to Dr. Barbara Fiddler in Toronto, whose model from about 15 years ago has been adapted and is used by many in Canada. And at a recent AFCC conference, Lynn Greenberg, who's a psychologist in California, published her model agreement. And they have various elements to them that I'll come to shortly if time permits. Other structural elements to build into this intervention include a definition of what the healthy family looks like. So it may sound weird, I guess, but there are actually models, descriptions of the very healthy behavior, in particular on the part of the children, so that you can tell objectively when you're getting close to that goal, close to how normal kids behave. In some cases where we want both parents working cooperatively, we do a weekly or monthly rating system for the children's behavior as against a whole list of criteria, so that you can start to apply some objective analysis to where you're making progress, where you're not making progress, and the children can see their own progress. See, one of the beauties of a protective separation, which is pitched by the denier community, and you guys know who you are, as traumatizing to the children when it's actually not. It frees them from the loyalty bind, is a structural intervention, temporary timeout for the favored parent empowers the children to be their own solution. Because the faster, and this can be explained to them, the faster they learn to treat their mom with the same respect and love that they treat their dad, the faster we're going to reintegrate their dad back into their parenting plan. So they become empowered in a positive way, instead of the typical over-empowered rejecting children that we're dealing with in these cases. And there's a whole analytical structure to why protective separations work, because we know they work. We have only to look at the experiential data set, but also the case law that is set when the favored parent wants back in and is proving their way back in. And generally those follow-on decisions, there's lots of recognition that great progress was made. And so we have a rapidly increasing data set to show that these protective separations work and why. But we hope not to have to get there by structuring, that's the purpose of this presentation, structuring an intervention that will work without resorting to that. So in addition to all the other teachings from the failed intervention, I'm going through here various structural elements, and I've spent some time on how we can look at the children's behavior objectively and see that it is improving and where the areas for continued improvement are required. Just like a school report card, the kids get it, and we can apply our parenting guidance, boundaries, incentives, and consequences to that scorecard and get the appropriate behavior. An important structural element is milestones. So I mentioned before, we don't want to find out in the 8th month that we've achieved nothing. There should be stated milestones along the way to monitor progress, and very often the children's behavior in the parallel non-therapeutic parenting time is a good milestone for that. And the children in therapy starting to accept that maybe they were a bit harsh, maybe they were a bit judgmental, maybe they were a bit overempowered, maybe they were a bit unforgiving, maybe they got some stuff wrong, is also a sign of progress. The pacing of the sessions I talked about before as a problem, so structure it so that there's frequent pacing and that the therapy takes a priority over all other activities of the children. Structure in ongoing feedback to counsel so that they can work with their own client if their client is not participating in the way expected or required. Have the ability for the therapist to issue formal interim reports to the parents and counsel, a mini report card. Have continued measurement, assessment, and adjustment of the process with a view to meeting the goals of that objectively stated healthy relations in the family system within the prescribed timeline. It helps if the reference is supported by a highly detailed and prescriptive court order beyond the parental covenants that I was referring to before. So these would be aspects of the referral the referral intervention order specifically directed to supporting that process. Number one is follow the therapist's directions. Number two, I've already mentioned the pacing, the priority of those sessions over other activities. Number three, the timeliness of responses to the therapist and the payment of fees. Number four, supporting the therapist's messaging and avoiding undermining the therapist's authority in messaging. If back in the home, or even worse, like right there in front of the therapist, the favored parent is arguing with the therapist and advocating for the child to the therapist, that's kind of exactly the opposite of the behavior that we need, because it's undermining the therapist process. In addition, a key clause, no right to terminate the process without court approval, because what favored parents who don't have that common motivation to have it work will frequently do is, if they see progress being made, they'll stop coming, or they'll have the children stop coming. Many of the components that go in the supporting court order are expanded upon with more detail and some other topics covered in that detailed reunification therapy contract that I'm referring to. And if anybody's interested in getting copies of some of these models, just reach out to me and I'll be happy to provide you with that. But the experienced therapists have really robust contracts. I mentioned before that the individual therapy that may be conducted in parallel, or might even be suggested / required by the reconciliation therapist, has to be subservient to and under the direction of the therapist. So again, no siloing, no therapeutic privacy or anything like that. So it has to be a collaborative process. The therapist needs the ability to require the parents, because the therapist is not a party to the court case, but the therapist needs the authority to force the parents through their counsel to convene a court conference so that the therapist can speak to the case management judge or just some judge appointed for the purpose of assisting the parties where the therapy has hit a roadblock. In addition, the therapist needs to be able, on their own initiative, or when requested by either parent, to prepare a formal interim report or indicate that they need a couple of more sessions because they're still in the middle of something important before they publish that report. I already mentioned check-ins with counsel so that counsel can assist the process. Often you'll have procedures for written submissions from the parties and counsel to the therapist. It can be efficient to give the therapist your background that way. On the other hand, you can't just flood the therapist with paper, and it makes it easier to, I guess, put in false narratives if you can just do anything without copying the other side. And the whole point of the therapy is that there is a common vision and that no one's entering into this process and behind the scenes saying the other parent is just too abusive for this to work. That is supposed to be prohibited at the outset, or if somebody wants to hold firm to that, get a court determination that they're not so abusive that they should have no relationship with the kids first. Quite often in these contentious matters, there are complaints or concerns or allegations about the therapist or the process, allegations of bias, allegations of not feeling heard, objections to the therapist being as directive as the therapists need to be in these situations. And you need a procedure to head those off early so that whoever's complaining doesn't disengage, even though that'd be a breach of the contract. There's other ways for them to check out. They can just check out mentally and be there physically, but not really participating in good faith if they're concerned about bias or that the whole process is wrong. So you need to anticipate that since this is not therapy and there's no therapeutic alliance and it's quite directive, quite uncomfortable, you need a parallel process where the work of the intervention isn't being done, but rather concerns and allegations and misunderstandings dealt with and resolved so that the intervention can continue with everybody participating in good faith. So I'm going to stop there since this was just booked for an hour, and I think for the most part I've covered at a high level why traditional therapy, unstructured therapy fails, and with knowledge of that, and with knowledge of the components of an intervention that stands a good chance of working if you can get everybody with the same goal, prepared to let the past go, and prepared to engage in good faith, which is, granted, not easy, it can work so that you don't have to resort to the structural intervention and a temporary timeout for the favored parent. And that reset works, and it works for many, many reasons. That can be the focus of another presentation, but we hope not to have to resort to that. So imagine if that was stated as the automatic next step if the structured intervention does not work. All members of the family would be highly incented to make it work. And so sometimes the jurisprudence and the empirical support for structured intervention, temporary timeout for the favored parent, just the possibility of it being the only remaining other option is enough to spur the family system with the assistance of all the tools that I mentioned and the appropriate experienced interventionist to heal and come out the other end with healthy relationships. We know from the equal shared parenting research that the best thing we can give kids other than an intact family is 2 equal, healthy, happy homes. And that's what this intervention can achieve. So thank you for hearing me out on that.